Electrocardiogram as a diagnostic tool. Author Medina Regalia, LVT. This presentation is for VETE 3316 Clinical Cardiology at Tarleton State University. What is an ECG machine? An electrocardiogram is also referred to as an ECG or EKG machine. It is utilized to record the electrical activities of the heart and is used as a tool to detect problems and monitor our patients. This non-invasive machine utilizes electrodes that can be placed or clipped to the animal's skin on the chest and legs. While it is a great resource tool for diagnosing patients, it does have its limitations. Things such as patient movement, loose leads, or misplaced leads can lead to false readings. This is why the ECG machine is often used in conjunction with other diagnostic tests, as well as the technician and doctor's ability to observe and identify any patient problems. What are some indications for use of the ECG machine? An ECG is an effective tool when assessing and monitoring several types of patients. If a possible arrhythmia is heard upon auscultation, we can non-invasively assess our patient using electrocardiography. Patients in the intensive care unit that may be experiencing breathing problems, shock, seizures, have existing or suspected cardiac murmurs are all good examples of what type of patients we are monitoring with this equipment. We can also use this machine to evaluate the effects of cardiac drugs, assess the degree of heart strain in patients with systemic diseases, as well as the obvious monitoring of our patients that are under the care of surgery, or assess their heart to determine if surgery is even a safe option. How do you use an ECG machine? The preparation and positioning of your patient. Before beginning use of the ECG machine, make sure the machine is well grounded to obtain an accurate reading, as well as for the safety of the patient and yourself. A rubber mat can be used for this purpose. You should also ensure your outlet is grounded and there are no loose or cracked wires on the machine. Animals should be placed in right lateral recumbency and their limbs should not be touching. Prior to beginning the ECG, ensure all of your cables and electrodes are also not touching each other or touching anything metallic. Next, we need to talk about lead placement. Leads should be placed in the stifle region. Your leads will be black, white, green, and red. The proper placement is as follows. Black should be placed on the front left limb. White should be placed on the front right limb. Green should be placed on the rear right limb, and red should be placed on the rear left limb. Using a fun way to remember the placement is helpful when initially learning to place the leads, or when you're in a hurry. The ones I personally use are white rhymes with right, and also clouds are over the grass and smoke is over the fire. You will need to have a conduction agent as well to obtain an accurate reading. Some examples would be alcohol, ECG pads, or an ECG paste. If the patient has long hair, it is preferable to have the patient shaved at the site of lead placement to achieve adequate conduction. Let's better understand how ECG paper and reading the results works. ECG paper is divided into a series of grids. The horizontal axis represents the time, and the vertical axis represents the millivolts, or in common terms, the amplitude of the heartbeat. On each horizontal axis, each 1 millimeter square represents 0.04 seconds, and each large square represents 0.2 seconds. On your vertical axis, each large square represents 0.5 millivolts. What information is obtained from an ECG machine? Let's look closer at the ECG and what it is measuring and define what each wave illustrates. The P wave depicts atrial muscle depolarization. Each cell depolarizes, in turn causing the atria to contract. The QRS wave depicts ventricular muscle depolarization. As a wave then travels down the conduction system, ventricular contraction occurs. The steps are organized like a dance, beginning with the septum and then continuing with the left and right ventricular walls. The T wave depicts ventricular relaxation, known as repolarization. Repolarization is the recovery period of the heart. In other words, it is the resting state after the cells have discharged their action potential. Reading ECGs properly can take some time and training. With experience, your proficiency will increase. When looking at normal ECG patterns, we can see that they are generally uniform in wave appearance. The canine ECG will often be larger than the felines. Featured on this slide are two normal wave patterns for canine and for feline. In the next two slides, we will briefly look at a few of the arrhythmias that the ECG machine can detect, as well as a few of the artifacts that can occur. There are numerous arrhythmias. This is just a small grouping of a few of them. The first indicates the patient is in sinus bradycardia. This rhythm that originates in the sinus node is conducted normally, but has too slow of a rate. The opposite of this would be sinus tachycardia, which also would feature a normal wave pattern, but the waves would be close together due to the fact that they are happening too rapidly. The second photo illustrates atrial fibrillation, which occurs when the heart is quivering, resulting in an irregular beat. This can ultimately lead to blood clots, stroke, heart failure, or other heart-related complications. The third image represents VPCs, or ventricular premature complexes. These originate below the AV node and do not activate the ventricles by the normal pathway. These complexes are wider than the normal QRS complexes because they have slower conduction through the ventricular muscle. Featured on this slide are some images of artifacts that occur and their reasoning. The first image is when the clips become loose or detached from your patient. The second image displays that there has been no conduction agent applied to the patient to enable an accurate reading. The third image displays inaccurate clip placement. A few other interferences that can occur are electrical interference from activity from a nearby machine, such as a pump or a cell phone. Patient movement can also mimic VPCs, so it is best to notate any movement on the ECG printout so as not to be confused later with a possible anomaly. There is a wide range of machines on the market. They range from very basic to quite sophisticated. More manufacturers are increasing the computational power and improving the signal processing of each machine. Featured in this slide is an extremely advanced CardioSecure ECG machine that is in Figure 12. This unit can be customized to the amount of leads your practice requires. The CardioSecure was designed for ultimate mobility and, while incredibly useful, may not be the most practical machine in veterinary medicine. In conclusion, the electrocardiogram is a very useful tool when assessing heart function. When used in conjunction with other diagnostic tests, we can greatly improve patient diagnosis, treatment, and monitoring. The ability to read ECGs will make you a more effective technician when you are able to identify heart anomalies, thus greatly improving your patient's outcome.